year, many new drugs come to market which offer hope to the sick and dying. They also bring billions of pounds into the coffers of the pharmaceutical industry, making Big Pharma the most profitable and powerful business on earth.
There is profits, and there are reasonable profits and affordable profits, and there are obscene profits. And what do you want?
This film investigates just how far drug companies are prepared to go to get their drugs approved and to get the prices they want.
They're not just pushing pills. They're pushing life or death.
From around the world, we put together evidence that has alarming implications for everyone whose health depends on prescription medicines. If Big Pharma's power remains unchecked, many more people will soon be dying for drugs. One of the initial steps in bringing a promising drug to market is to test it on humans. Increasingly, those experiments are taking place in the developing world, far away from the scrutiny of the European or American authorities.
Lokacin da ake wannan kwalara a takaice mun rufe mutum ɗaya mace da namiji yaro da babba sama da 1,500 wannan tabbas. Yawan kake zo a ɗaya rana muna binne 12 muna binne 15 akwai ranar da muka binne 18 ma ɗaya rana. Wata uku da wajen kwana 25 ana ba ta yi sauki ba kwarai kwa.
In 1996, the northern Nigerian town of Kano was already staggering under the weight of cholera and measles epidemics when a third, even more deadly disease arrived: meningitis. Infection quickly spread through the cramped and overcrowded slums, and within weeks, thousands of children were infected, hundreds died. Another deadly African epidemic, like so many, it went wholly unreported in the West. But it did not go wholly unnoticed. It was picked up in America on an internet message in the Connecticut research headquarters of the world's biggest and richest drug company, Pfizer. Pfizer moved fast. They chartered a plane to fly to Nigeria with a new drug, both a potential lifesaver and a potential billion-dollar money spinner: Truevision. But Truevision had never been tested on children before. Agu Arondu was a doctor working at the infectious disease hospital in Kano during the epidemic.
Initially we had dozens a day, and we didn't have hundreds a day, thousands a day, and that's how it was. They came coming, but we managed. It was a bad time for Kano. People were scared. There was fear on everybody's face. Meningitis, cholera, measles. So it was a very bad time in Kano. Fear, fear, fear.
At the time, Anas was 6 years old. His parents vividly remember what happened.
Lokacin da ya fara a gida yana zazzabi, ciwon kai, yana faduwa haka, yana surutai, sai hankali na ya tashi. Shine na dauke shi na kai shi asibiti.
The time when we go to the hospital, that time the hospital is full with children, with some people. All the children is more than the adults.
Today, the infectious diseases hospital is almost deserted. But at the time, it was so crowded that the medical charity Médecins Sans Frontières, which had flown in to fight the epidemic several weeks before Pfizer, had to put up tents in the grounds in which to treat the children.
Altogether, it was probably 150,000 people that got affected by this meningitis epidemic, of which more than 15,000 died. We had queues of people turning up to the infectious disease hospital. As the word spread that treatment was available for free, people started moving away from the countryside, gathering into Kano City.
MSF had already been in Kano for many weeks and had successfully treated thousands of patients when the Pfizer team arrived at the hospital. The very next day, Anas was brought in, suffering from the classic symptoms of meningitis.
So they give him the card and they take him to the doctors when they come from overseas. They take him to one room. So they do the injection. From that time they take him to bed.
Anas's father showed us the card that he was given by the white doctors. At the time, he assumed they were simply there to help, like the MSF doctors. Later, the printed label on the card led him to question their motives. Pfizer meningitis study 154149, patient 0001. The very first person they tested. There are strict rules on the conduct of experiments on humans, drafted at Nuremberg after World War II.
There is the Nuremberg Code, which does codify very clearly the rules in trials, and it's quite striking to see that the first sentence is that voluntary consent is essential.
You have to get informed consent. It's part of the social contract between the person whose health is being put on the line for the study and the people who are actually conducting the study.
The fact that consent to an experiment has been given and that the risks have been properly explained and understood is normally recorded on a consent form bearing the signature of the patient, or in this case, a parent. But Pfizer has never produced a single consent form from the 200-odd children that were treated in the Trovan experiment. Pfizer say that because nearly all the parents couldn't speak English and could neither read nor write, a local nurse explained the risks of the trial to them and got their consent verbally. So what was explained when the very first child that Pfizer used in their experiment, Anas, was taken away by the white doctors?
They didn't explain anything, just they said they wanted to help the children about these medicines. They didn't talk anything, only the thing they talk.
Did they tell you about any of the dangers of the side effects of the medicine?
No, they didn't tell anything.
And did they ask your permission?
No, they didn't ask me for anything.
Pfizer have said that the parents of the children who were treated were unable to read and write. What is your answer to that?
No, I'm reading, I'm writing, I speak English, I read in English and Hausa, and Arabic, all I'm reading and writing.
100 sets of parents have so far stated that they too were not asked for their consent. Pfizer, by contrast, still do not concede that a single consent was lacking. Somebody is lying. Ali Ahmed is a lawyer who is trying to sue Pfizer on behalf of the patients affected by their experiment. If they had got formal consent, do you think they would have had as many subjects?
One thing I'm sure is that in this culture, if they had told the subjects that they were being used for experimental purposes and that they had option to seek for actual treatment rather than they using them as subjects for medical experiment, then they wouldn't have gotten even one subject if they had done that.
Not telling your test subjects what you're doing is a fundamental breach of medical ethics. But it's not the only charge against Pfizer in Kano. Trials like this must be approved in advance by an ethics committee, and there's clear evidence that Pfizer failed to do this in Kano.
The ethics committee never existed when they came. They never got any permission. They just got here, did what they did, and as an afterthought, got this letter, drafted it, backdated it, and it was clearly fraudulent. It's disgusting. It's disgusting.
Pfizer's Ethics Committee approval letter is dated March 28, 1996, and is written on the headed paper of the Aminu Kano Teaching Hospital. But this Ethics Committee did not exist in March 1996. The Pfizer doctor in charge of the experiment later admitted getting the approval letter backdated. He said that this reflected a verbal agreement he had at the time. Disturbing though Pfizer's behaviour was in Nigeria, it's sadly far from unique. Several leading drug companies have also conducted questionable trials, increasingly in the poorer countries of the world.
There's many documented cases of lack of informed consent, trials being done with inappropriate supervision in terms of the quality of the treatment, the controls, the conditions. So it's a problem. It's a problem because they're operating in an environment where there's really very few people around to protect the patient interest.
Concern about trials in the developing world has become so widespread that the Nuffield Council on Bioethics last year published detailed recommendations on the ethical conduct of trials, to widespread silence from the big pharma companies.
These are the biggest companies on earth that portray themselves as the paragons of enlightenment and science, and for them to go in and just throw the rules out the window because they're just so desperate to bring another blockbuster product onto the market is really inexcusable, and it's the kind of thing that the world community has to deal with. They have to actually learn how to discipline and regulate the companies, even when they operate in developing countries.
Ever since the Kano trial, Anas has had a pain in his knee which stops him from running and playing with the other children. This could have been caused by the meningitis, but damage to joints was known to be a side effect of the drug Pfizer was testing before the Kano experiment. The US refused to license Truevision for children, partly because of the joint pain caused in the Kano experiment. So we asked Dr. Agu to try to diagnose the origin of the pain in Anas's knee.
Pfizer is aware that this drug damages the joints, no matter how little. So it was very wrong of Pfizer to come and conduct that test.
The X-rays showed that the joint was inflamed, but the doctor felt there is no way of knowing what caused the damage. All he can do now is put Anas on a course of anti-inflammatories. Anas did at least survive. Other children were not so lucky. An 8-year-old little girl, whose name has been lost but who is referred to in Pfizer's notes simply as Patient 69, weighed just 3 stone when she arrived. She was given an oral dose of Truevision. A day later, although she was going downhill, the Pfizer doctors, rather than switching her to a proven drug, repeated the same dose. On the 3rd day, she died. It's impossible to say whether she would have survived if she'd been switched to the alternative drug, but if a patient is not responding to one treatment and their life is on the line, it's standard practice to change the treatment.
You adjust the treatment according to the response. For infections, depending on the infection, you allow a period of time and then adjust accordingly.
If I'm in charge of that case, I'll change to a tested drug. No question about it. And I'm sure most doctors will do the same. Because meningitis is a very severe illness. And the organ is affecting is... So it's not something to play. I think they played with that baby.
Last month, Pfizer told us it remains satisfied that the Kano experiment was conducted properly throughout. But while Truevision has since been largely withdrawn after several patients died from liver damage caused by the drug, the battle to get compensation for the children used in the Kano trial is now being fought by lawyers in New York. Central to their case is perhaps the most damning piece of evidence against Pfizer, a letter sent to the chairman by the company's own childhood disease specialist, Dr. Juan Walterspiel, protesting in the strongest possible terms about the trial. Dr. Walterspiel details 8 major objections to the trial, including the fact that the drug was not tested against this type of meningitis before the first child was exposed to a live-or-die experiment. He stresses that because most of the children were severely malnourished, it was very risky to give them an antibiotic by mouth. And referring to the lack of consent forms, he concludes it makes one wonder what parents were told for expediency's sake. It was as a result of these complaints, says Dr. Walterspiel, that shortly after he sent this letter, Pfizer sacked him.
Dr. Walterspiel said in his letter, he took a brave stand saying this was completely inappropriate what had happened here in this testing, and I think he was trying to sort of stand up for the good science, as it were. And in response, what happened to him was he was terminated. He lost his job. He had difficulty finding another job. So this has been an incredibly difficult result for Dr. Walterspiel, and it's unfortunate that a research scientist that actually speaks up and says this isn't right, something's wrong here, is punished in this way.
But even with such powerful evidence on their side, justice moves slowly for Anas and the other patients affected by the trial. A New York judge has ruled that Pfizer does have a case to answer, but has also agreed with Pfizer that the case should be heard in a Nigerian court. Transparency International rate Nigeria as the second most corrupt country in the world, so Elaine Cusel is appealing to have the case heard in the USA.
What this situation means for Anas and the other victims is that justice is delayed here. We hope it's not justice denied. These are people who now, unfortunately, have to wait even longer to get some sort of compensation and to get some sort of redress. And all of this is being delayed because of these legal tactics. Every person, no matter how poor, no matter how humble their lifestyle, they have a right to say, this is my body, and I don't want you to do anything to it. And that's a basic right to say, I don't want to participate in a medical experiment. And they weren't given that opportunity here, and that just can't go on.
The Trovan case is just one example of how patients can be unwittingly used to test a new drug. But even when the patients are fully informed and willing to take part in a trial, what happens when their doctor wants to warn them of the possible dangers of a treatment, but the drug company disagrees?
Many, many children in Europe right now are taking what I believe is a drug that is neither adequately effective in most patients or safe.
Patrizio has a blood disease called thalassemia. Her body doesn't make red blood cells, so she has to have a blood transfusion every few weeks. The new blood keeps her alive, but it also has a side effect. Over time, the iron from the hemoglobin will destroy her heart and her liver. So to flush out the deadly iron, Patrizio has to endure a 10-hour ritual every day, slowly infusing a drug into her arm or leg.
I prepare it every night. It's mixed with medicine and sterile water in syringes, and it's just injected in. When I was little, I didn't like it. I was like whining and stuff like that, but I would always say it's painful or stuff like that. It still is. It's not that it isn't, but I'm more used to it now. I know why I need it. At the time, I didn't. I was too young to understand.
The specialist who's looked after Patrizio all her life is Dr. Nancy Olivieri, one of the world's leading experts on thalassemia.
She's very loving. That's a perfect way to explain it to her, about her. Very caring about her patients.
So what drugs are you on now?
Dr. Olivieri has been searching for an alternative to the painful nightly infusions for many years.
I was interested in finding an alternative because My patients, especially as they got older, found it very difficult to go on with the medicine, mixing it up and sticking it under the skin every night. It's not so much painful as inconvenient. As you're growing up, you have to be home at a certain time, have to be there all night for 12 hours to get the infusion, so it's quite cumbersome and inconvenient. And I knew that a pill would improve compliance in patients. A pill given 2 or 3 times a day would be much better than an infusion under the skin every night.
The drug Dr. Olivieri wanted to try was called L1, and after initial small-scale trials looked promising, pharmaceutical company Apotex agreed to fund international trials, starting here in Toronto. The prize for Apotex would be control of a drug potentially worth millions of dollars worldwide.
The trial went very well. We did liver biopsies every year, and patients appeared to have their liver irons becoming reduced or stabilizing at acceptable levels. And we published those data in the New England Journal of Medicine.
But after initial euphoria at the success of the trial, Dr. Olivieri began to detect changes in the iron levels in some of her patients that worried her.
We said, what's going on? This is coming up to the level of cardiac disease and early death, and we were quite concerned. So at that point, we felt the patient should at least be told, and then they could make a decision based on that. But we didn't want to stop the trials because we thought there was a way to figure this out.
Still keen to find a way to avoid sending her patients back to the nightly needles, Dr. Olivieri wanted to adapt the trial to work out exactly why the drug seemed to be working less well in some patients. She was unprepared for the reaction of the drug company Apotex, whose potential multi-million-dollar drug she was now questioning.
It was May 24th, it was a Friday, and I came back, and on my answer phone was a long voicemail from Mike Spino.
Message 1. It's Mike Spino. I'm sorry that has decided to make the L1 study. All of our patients will have to be advised, and Apotex has decided that this is the best thing to do at this time, and that we have every intention of bringing it to market as soon as possible. And I want to remind you the confidentiality requirements under the contract. You must not publish or divulge information to others about the work you have done with Apotex. Should you choose to violate this agreement, you will be subject to legal action. We've notified HPP about
The vice president of Apotex was telling Dr. Olivieri that the Toronto trials were terminated, she was fired as the chair of the worldwide trials, and gagged from telling her patients or anyone else her concerns about the drug. Concerns Apotex described as misinterpretations of the data.
My heart was just racing. I didn't know what I was going to do because I didn't know what to do about the patients. I didn't know that the hospital wouldn't be supportive, but I had a sense that I was in this by myself. It was a sick feeling.
At Oxford University, one of the world's leading authorities on thalassemia was alarmed when the news of Dr. Olivieri's gagging leaked out.
It seems to me that there was a fundamental issue here of what you might call academic freedom, and if a company tries to stop that, then we have a problem.
Many people would say Apotex had a right to protect their investment.
Yes. But the way to do that is not to kind of rush in and close things down in 24 hours and tell a scientist that you aren't going to take kind of legal action if they disclose.
They may disagree with her medical opinion, but they cannot disagree with her right and duty to tell patients, because they're her patients, and the most important thing is the relationship between her and the patients. They can't interfere with that. They cannot. And so what they did was outrageous. People have to grasp that.
Apotex came through and swept the drug from the pharmacy shelf where it was being dispensed to all the patients, so there was no more drug. And they had no explanations. It was terrifying for some of the patients. The people who were on the front lines with the patients were just saying, well, we'll see what we can do. There's no drug left. You'll just have to continue on the drug you're on right now and keep on until that runs out. So there's enormous confusion.
The university eventually persuaded Apotex on compassionate grounds to keep supplying the drug to the patients who were doing well. But the company continued to threaten Dr. Olivieri with legal action if she told either the patients or anyone else about her concerns. But then Dr. Olivieri became even more worried about the possible side effects of the drug. Over the years, all her patients regularly